All right, everybody, we're going to go ahead and get started. My name is Jennifer Drake Croft. I'm the Director of Child Wellbeing with the Tennessee Commission on Children and Youth. And I want to thank you all for joining us today with this special webinar with the Campaign for Trauma-Informed Policy and Practice. We are so excited that they are here with us. I want to remind everybody that this webinar is being recorded, and I want to remind everybody to please keep yourselves on mute so that we don't have any audio interference. If you have questions for the presenters, please put them in the chat box. I'll be chatting occasionally just so that you all have that in front of you. And then we will have about 10 minutes at the end where I will read aloud the questions for the benefit of the folks that are joining us via phone. So without further ado, I'm so excited to introduce you all to Dan Press, who really coordinates and helps run the Campaign for Trauma-Informed Policy Practice. So Dan, if you'll just give a little introduction of yourself and what CTIPP is, and then introduce Jesse and Marlo for us, please.
Sure, thank you. Actually, I want to begin by saying what an honor it is to be on the phone with the Tennessee trauma-informed community. It was the articles, I don't know, 3-4 years ago about Tennessee deciding to become a trauma-informed state that really triggered my desire to move forward and see how that message could be taken all across the country. So I just want to thank your visionary First Lady, your visionary Governor, Jim Henry, your not only visionary but hardworking Deputy Governor, for really inspiring me and so many other people around the country by declaring that Tennessee was going to be the first trauma-informed state. You really have been a groundbreaker and a model we point to all the time when we're working with other states. Also, I just want to thank 4 extraordinary people. Hopefully they're all on the line. In Tennessee, just amazing trauma for advocates and doers who have never said no any request I've ever made to them. Jen, you, and Becky Haas, and Mary Ronaldo, and Renee Wilson-Simmons, who is also a board member of CTIPP. So you've got some extraordinary people in your state, and we're really, really pleased to have an opportunity to talk with you today. I am the pro bono general counsel for the Campaign for Trauma-Informed Policy and Practice. I'm a partner in a Washington, D.C. law firm where I spent my career representing American Indian tribes. And as I started closing down my practice, I learned about trauma. So I've stayed with my firm, but now spend all my time doing pro bono work with 2 organizations, the Campaign for Trauma-Informed Policy and Practice and a Native American Trauma-Informed organization. My kids are jealous that I'm able to do exactly what I love doing every day without any pressure and any stress. And I tell them all you have to do is work 45 years and you can reach this point too. So I really consider myself fortunate. I'd like to introduce 2 of the pillars of the Campaign for Trauma-Informed Policy and Practices initiatives. Jesse Kohler, you want to introduce yourself?
Sure. So thanks, Dan. I'm on the other side of that 45 years that I hope to get to where Dan is at someday. I joined the Campaign for Trauma-Informed Policy and Practice last year as the fundraising chair. I am currently the Director of Development for the Community Center in Philadelphia, but I am in a month going to be starting a new job in D.C., working on advocacy for an organization called Counsel for a Strong America. I have been truly privileged and fortunate to have the ability to work with amazing people like Dan, Marlo, and everyone on this call to, work toward a trauma-informed future and really get to do something that is significant and matters. So this national trauma campaign is something that's incredibly important to me, and I know, the other members of this group, like Dan and Marlo, who you'll hear from next.
Marlo?
Yeah, thanks, Jesse, and thanks, Dan. It is a true pleasure to be with you all today. I didn't even know that you were Dan's inspiration, but I could tell you that Dan is the inspiration for many things that you will hear about today. So I hope that you feel some connectedness to how this is kind of, all of this work is coming full circle. I am the National Director of Partnerships and Policy for St. Francis Ministries, which is a 75-year-old nonprofit organization that rebuilds and builds child and family well-being, primarily through child welfare-related services like family preservation, foster care and adoption, substance use treatment, mental health treatment. And in 6 states in the Midwest, we're headquartered in Kansas. I work out of DC, and I lead the organization's federal policy work and then provide partnership and sometimes consultation in states for advocacy and policy change. And I've done a lot of work recently in the implementation of the Family First Prevention Services Act and helping states do that work. I was formerly with the Alliance for Strong Families and Communities and was actually connected to some of you through that work because of the Change in Mind initiative and the connection that you all have had with that work. And I am a member of the National Trauma Campaign Core Team, so delighted to be here today to talk with you about that work.
Thank you, Jesse. Thank you, Marlo. What we're going to do is I'm going to talk a little bit about the Campaign for Trauma-Informed Policy, CTIPP, how we got to be where we are today. And then we have several different initiatives going. One which Jesse and Marlo are running is a campaign to recruit trauma-informed advocates in every congressional district to educate your congressional offices about trauma. The background on that is when I first got involved with CTIPP, I've spent a lot of my time during my career working with Congress, lobbying on behalf of tribes. So I went up to the Hill and started recommending that they incorporate trauma-informed concepts into their legislation. And I thought it was going to be an easy sell. For example, there was a recent World Health Organization study which found that ACEs cost the United States over $700 billion a year just in healthcare costs. So the argument is you want to reduce budgets, you want to reduce healthcare costs, reduce ACEs. But when I got up there and started talking about ACEs, I got a lot of blank looks. Congress seems to be one of the few places left in this country where there really isn't a great understanding of adverse childhood experiences, trauma, all of the neuroscience that has been developed over the last 20 years on the impact of early childhood adversity. So we realized that we aren't going to develop a constituency in the Congress for trauma-informed legislation until they become educated about trauma science. And the best advocates, the best lobbyists on any issue are constituents of the Congress people. I can go up to the Hill and talk, but when they hear from somebody who's a voter, they really pay attention. So we've put together a campaign that Jesse will be talking about to start at the grassroots to educate congressional offices in each of the 435 congressional districts and the 100 Senate offices to become trauma smart, trauma knowledgeable, with the goal of a year from now actually advocating for comprehensive trauma-informed legislation that incorporates trauma principles into all of the areas where it's needed: prevention, early identification, mitigation through resilience training, treatment, workforce development, and most importantly in our mind, development of community-based trauma-informed initiatives like many of you have done in Tennessee, because implementing trauma-informed programs has got to be done community by community. There's no one-size-fits-all, and that requires that there be an active trauma-informed coalition that breaks down the silos, that brings together all the different sectors and institutions, education and healthcare, and law enforcement and business and social services and so on, working together to address trauma. So if we had to identify our highest legislative priority is to get funding for local trauma-informed initiatives, but behind that is to incorporate trauma-informed programs into every aspect of the federal government where we know trauma has an impact. So Jesse will talk about the campaign, and then when the pandemic, COVID-19 hit, we realized that with some additional issues we needed to become very active in, including the legislation that Congress has already passed and legislation Congress will soon be passing, because we know from history of every disaster in this country that it's followed by a spike in trauma-related behavior. The kids in school act out more. Kids on the street more act out more. There's an increase in child abuse, domestic violence, drug use. So while the pandemic is a huge problem, we're still trying to send a message that there's a second major epidemic behind it, and that's the trauma that's going to be unleashed when the quarantine is over and people are back out in school and on the streets. So Marlo will be talking about that. And then the third CTIPP initiative is networking, is bringing together all the amazing trauma-informed advocates from around the country to share their experiences, share their problems, share the lessons they've learned. I've been fortunate. I've been spending time on the phone over the last couple of months with trauma-informed advocates from all over the country, state by state, and the states are way ahead of the federal government. And there are so many extraordinary people out there doing such extraordinary work, from Alaska to Florida, from New York to Texas to California to Arizona, just all over. And what CTIPP is trying to do is to be the entity that links all of those together so that we create a national trauma-informed community. And our vision is that community eventually sets the agenda for this country and puts the powerful neuroscience that we know exists in regard to trauma, puts it to work in every aspect of our communities. So that's what CTIPP is all about. We're a volunteer organization. We don't have any funding. I think we have $5,000 in the bank, but we operate on the energy and commitment and passion of a whole bunch of terrific people, including people like Renee Wilson-Simmons from the ACEs Awareness Foundation in Shelby County. And we tap into all of the other wonderful people like the ones I mentioned earlier, Jen and Mary and Becky. So that's who CTIPP is, and I'd like to turn it over now. Jesse, you going next?
So we will actually go to Marlo next,
okay,
to discuss the state-specific and legislative aspects of this.
That's right. Yeah, they switched agendas on me, and I couldn't remember. Okay.
That's all right. Thank you. You ready for me to go, Dan? Uh-huh.
Yeah, go ahead.
Okay. Thank you. Well, it's my role today to talk to you about 3 ways the campaign is activating our national network. And I just want to re-emphasize as I do this that Anyone is welcome to join the campaign. We have general campaign membership, and our goal is to activate such a large grassroots movement that there is a sense in Congress that there's just a groundswell of support from their constituents for activating trauma-informed legislation. So, and then in addition, we are recruiting local liaisons who are volunteers who've agreed to take on the special role of being at least one of the points of contact for the members of your congressional delegation. So local liaisons are also volunteers of the campaign that have taken on an additional role. But as you listen to what we have to share today, just know that it's accessible to everyone who's on the call, and we hope that you'll join us in creating this wave of influence. So our 3 calls to action that we want to talk to you about today are, the first is working to influence the use of flexible federal funds to ensure a trauma-informed COVID-19 response in Tennessee and in localities across your state. The second is we want to engage your help in growing the National Trauma Campaign. And then the third is through the Trauma Campaign and with our support and tools to continue to educate congressional offices in anticipation of a 4th and other future federal COVID packages. So I'm going to speak to each one of these. The first is there's a major development out of Congress, and that is that particularly with the CARES Act, but across the 3 bills that Congress has passed so far as part of its response to the pandemic, there is quite a bit of money coming to states through different avenues, financing streams for different purposes. But one thing that is frequently true about these financing streams is that there is a good deal of flexibility for the local authority to determine how the money is spent. And there's frequent mention of needing to address mental health issues, no mention of trauma. So what we're very clear about is that there are no specific trauma provisions in this first round of federal legislation and no direction that anything be trauma informed. So I will say that, and I'll speak to this more in a minute, going forward, we are trying to influence that so that there's more that comes down from the federal government that is either specifically a trauma-informed provision or requires a trauma-informed response from the recipient of the funds and then therefore the distributor of the funds. But at this stage, the money that's been approved has none of that connection to or encouragement or requirement to be implemented in a trauma-informed way. So it's very important that you all understand that you have a role to play in communicating with the influencers and the decision makers in your states about these federal funds to direct them to be implemented in a trauma-informed way. So funds are going to schools, to public health agencies, to community action agencies, to your housing and homeless agency. There are the funds pay for different things, and we didn't plan today to do a detailed walkthrough because honestly it's fairly overwhelming. But we are developing a paper that we will have available by the end of this week or early next week that lays it all out. But today we just wanted you to get that sense that money is going to be flowing through several of your agencies. I'll talk specifically about schools because it's one I think we all collectively work on quite a bit. And it will give you an idea of what I mean by how funds are being flexible and how they're being administered both state and locally. So for example, in the school funds, there's an overall education stabilization fund. Within that fund, there is the Governor's Emergency Education Relief Fund, which is totally flexible dollars for the governor to determine how is spent in the state. And so being in communication with those who will administer that, whether that's your superintendent of education, your secretary of education, it depends on how you're structured in Tennessee, but to think through how you might communicate to that decision maker that you want some of that, you would like some of that money to be in play to ensure that all schools are trauma informed. The other one is that the largest pot of money is going out to local education authorities, and the language in the law says it's intended to support long-term school closures, and one of the things it includes on the list is to put mental health supports in place. So the language is fairly general. It's quite a bit of money, and it will be the local education authority who will have influence on how that money is spent. Then in the Education Stabilization Fund, there's also an amount of money going toward higher education for much that same purpose, to stabilize higher education institutions and also the students. Where there, in issues that we know particularly cause trauma, there's a little bit of money that's come forward, but very little. So for example, for domestic violence, there was $45 million so far. And this is against what we know in the news, that there's already been a significant spike in reports of domestic violence. In this first package of bills, there was $45 million for child welfare. Both of those amounts are, as you can imagine, drops in the bucket for what is actually needed. So both of those issues need to be lifted up, and the systems that address those issues need to have much more funding going to them generally, and obviously an emphasis on being trauma informed as well. There's a little bit of money in this first package, relatively little bit of money to substance use treatment and suicide prevention. So I just want to give you a sense that there's acknowledgement of the mental health issues this pandemic is causing, but not that sense that it is, as one article I read this week called it, the silent pandemic that's occurring now and will have long-term effects beyond the time at which we have the physical threat of this pandemic contained. So with that information, we're encouraging you, and later this week and early next week, we'll be through the campaign sharing tools to support your efforts in coordinating to influence the direction of those funds to trauma-informed activities. And I just want to encourage you, as you well know, that there are things that can be done now and are so needed now, and then things that can be put in place to endure over time to help with the trauma and mental health effects of the pandemic, even after the physical threat has been contained. The second call to action that we have is to ask you to help us grow the National Trauma Campaign. As I mentioned earlier, we want to give Congress that sense of a groundswell of support for them taking action to put in specific trauma-informed provisions, and also just make legislation, make policies through a trauma lens. And so I can update you on some inroads that we have made through the national campaign with some of our partners at the national level to give you a sense of how we're teeing up this topic for the next round of COVID legislation. But I want to emphasize a couple things. One, none of this has passed yet, so these are all hoped for ideas that we've gotten into the pipeline, and I'll explain how in a minute. And then also just emphasize that getting these ideas passed is where we really need your help to become involved in the campaign. And so really, before I go into that, I will say the third call to action is related in the same way. So we need the congressional offices hearing regularly from people like you all who are passionate about trauma science, who understand, who can talk about concrete ways to become, quote unquote, trauma informed, and who can educate your congressional delegation on the importance of them taking up this banner along with you. So some of the ways that we have made inroads that we're excited about, but it's going to take work to get this to actually become real in the next round of legislation, is that there was something called a Dear Colleague letter out of the House, a bipartisan letter that was sent by 20 House members to House leadership that essentially put a set of provisions into the pot of different ideas they're thinking about putting forward for the next COVID package. So I just want to give you an idea of what some of those things are so you understand the direction that this is going. The letter said, there's evidence that shows that there's long-standing impact of traumatic stress, but it can be mitigated. It points out that Congress has recognized in the past the importance of identifying and treating and addressing trauma, and it did so in the Support for Patients and Communities Act, which was the opioid response bill. So basically, this is the House members saying to their colleagues, we've done this before, we need to do more of it going forward. So there is a call for money to cause the Secretary of Education and SAMHSA to work together to provide grants that link educational agencies with mental health systems across the country to increase student access to services. There is a request in it for supplemental appropriation for SAMHSA's Project Aware, which I believe you have in Tennessee. So the money would be to give additional funding to current grantees and add more grantees across the country. There's additional money for the National Child Traumatic Stress Network for them to get more money out to their grantees. Half of that money they're requesting to be provided for resources for families, caregivers, early care and education programs, teachers, principals, administrators, and other school leaders to care for children, and the other half to dedicate to addressing secondary trauma to support first responders, the health workforce, and their children. In addition to those specific things that we know were sent through this Dear Colleague letter, we also know that a more detailed and expansive memo went to House leadership. That wasn't shared publicly, but we are encouraged to know that they not only sent this short list of items they would like to see in future legislation, but they've expanded that list, and so there's hopefully even more being discussed. In addition, the Senate champions for trauma legislation in the past are also negotiating in a bipartisan way to develop a Senate letter that's companion to the House letter that I just overviewed for you. So that is all new activity in the space of federal COVID-19 response and recovery legislation. And the campaign has been a real energy force for making that happen. And we are also working with a large group of other national organizations to try to create a collaborative trauma agenda. So there is many of you may have seen, there is a national child maltreatment prevention and child welfare agenda. A number of you may have signed on to that. The groups leading that effort are now talking about how those resources would also help prevent and address trauma. So there are ways with other groups that already have a policy agenda in play in Congress. We're trying to link the narrative to help Congress understand how these things work together and how they all work to prevent and address trauma, so that, again, hopefully knitting together and collecting together efforts to have Congress just feel like they're hearing about the need for being trauma informed from every direction they turn. That's what we're going for. So that's really, let me just look. I think that's all I have now. Just to say that Jesse's now going to tell you about some of the things that we already have available, and just know that we've got additional things in the pipeline. And when we get to Q&A, we would love to hear the kinds of things that questions you have, obviously, but also the kinds of things that you feel like would be helpful in your role in engaging with the campaign. So Jesse, I'll turn it over to you.
Thanks, Marlo. It's a really great overview. I always learn something new, whenever you share your insights. So I know that we've been over this, but a quick rerun over what the campaign was created to do and where we're at now is we launched 2 months ago. We're already in 45 states and continuing to expand. We can certainly grow more within each of those states, but it's great to be able to leverage the networks within the states once we have representation there. So our major objective is to open up lines of communication around the issues that Marla was just saying, as well as others, though she pretty much summed up most of it, for there to be a local liaison or some sort of campaign representation to open up a line of communication with every congressional office. That's all 435 representative offices and all 100 Senate offices. There are ways that I will show you to sign on, but the big thing is that when you sign on, we are working to engage members through various webinars, through virtual watch parties to keep people engaged, as well as encouraging them to organize at the local level like you all already do. But the calls to action that we put out are so crucial to what Marla was just saying in terms of being able to organize collective action toward a specific agenda from across the nation in various districts. It really helps to motivate Congress to take action on those things. And there's Dan's point about just the strict cost of adverse childhood experiences and trauma as we expand what this one study was looking at. The cost is so high that this is something that matters to all Congress. It can support programs, and so we believe very strongly in what we're advocating for and how that can help us fund programs in the future. So we invite everyone on this call, and while I am running through the website that we have put in place with tools, I invite you to actually minimize the screen that I'm sharing and go to our website, which is ctipp.org/National Trauma Campaign, or you can go to ctipp.org, CTIPP.org, and there's a National Trauma Campaign button. And we will make these slides available. We're a very transparent group, so we have no problems doing that, just to answer that question that I saw come up a few times. So just so you all know. So this is our website. The first place that I will go is actually section 3, really quick, to show you where, if you want to sign up for the campaign, you're going to want to go to this constituent engagement section. Our local liaisons are the ones who are really constantly getting these calls to action and communicating with congressional offices these various calls to action, whether that's trying to get people to sign on to the David Trone letter, which has already gone out, or if it's back to more so what we were initially organizing around before the current pandemic took off, and it's sort of these education outreaches and trying to establish lines of communication to teach the Congress people about what you know about adversity and trauma and the promises of trauma-informed care. So we invite people to sign up as a local liaison. We also have an opportunity for organizations to sign up, and there's an individual sign up as well. But again, that's going to be in the constituent engagement section of our website. The rest of our website is going to have a lot of documents and tools for you all to use to better understand the campaign, a lot of what we've already talked about on this webinar, as well as tools to use and leverage when you're in conversation with Congress or trying to recruit people for the campaign. So again, this first section of Join the Campaign is really what the first part of this webinar was all about. It's just the background. It's understanding what the campaign is trying to do. This Take Action section is sort of like the Bible of what our campaign has to offer. This What is a Caucus section is going to change to be a COVID toolkit. So a lot of what Marla was just talking about, we are going to end up putting in this section in the coming days as we organize that information and have a toolkit available for people to use. These talking points documents were initially created when we were first launching to actually have that stable line of communication from all 435 congressional districts to their Congress people. It's going to help inform how we can talk about these issues, some strategies when talking to Congress people, for those of you who may never have done that before. That can all be found in this talking points document. And then this action toolkit has a ton of information and is very easily navigable by these links here. So for instance, there's a caucus ask email template that we will have a call for action for when Congress is sort of out of the shade of the coronavirus times, where they're pretty much inundated with just that right now. But this caucus ask email template is for you to share with Congress people's staff. Oftentimes we would have to send it in through an automatic form that is available on their website. But all of this in the action toolkit is made for you all to have success in navigating the conversations around these issues with your Congress people. So that can all be found in the Take Action section. And then we have a number of resources that are available to people that you can use either for your own knowledge and understanding or in talking to Congress. We really encourage you to use these campaign infographics that were created by one of our co-volunteer / co-workers, Whitney, who has sort of created 3 infographics that help to outline, some of the promises of trauma-informed care, some of the costs around trauma and ACEs, and also offer potential solutions. They are a great supplement to conversations that you can have because they are visual. And they sort of sum things up. Doesn't usually take this long to load, but it usually sums things up that you are going to say in a really easy way for it to become more sticky to the Congress people that we talk to. When we talk to Congress and their staff, we may only get 10, 15 minutes, and so we really need to make sure that the information that we are providing them sticks in their minds. So that's where you can find the campaign infographics, and then we have all of these social media infographics. Before I go on, one of the things that I want to share with you is a video that will support the COVID ask and will supplement any material that is sent to Congress about coronavirus specifically, which was done in partnership with an organization that has signed on to the campaign, Star Commonwealth. So I will be quiet for 3 minutes while we go over this video. Afterward, we would love to get any feedback that you all have about the video and, hear some of your thoughts, but I will play that now.
And the world are our communities, nation, and the world are facing what many are calling a trauma tsunami. We face uncertain days ahead, battling the effects of the coronavirus pandemic, which has made trauma a daily occurrence for many. As the immediate social, economic, and human impact is clear, we must also prepare for the upcoming flood of trauma that will follow. Trauma is common, pervasive, and expensive, and it has never been more important to understand. Trauma can happen because of different experiences, but we all react to these experiences differently. Trauma triggers the stress response. The stress response causes the body to release large amounts of stress hormones, which increase heart rate, respiration rate, and muscle tension. Some stress is tolerable, but the stress response is only meant to last a short time. When trauma is prolonged and exaggerated, just like it is for many during this pandemic, our bodies begin to feel out of sorts. When we can no longer explain emotions or behavior, it could be due to trauma. These overwhelming reactions and symptoms take a toll, not just on individuals, but also on families, communities, and societies. This is the dangerous snowball effect of the trauma tsunami from COVID-19. a pandemic that has already swept the nation with some of the same traumatic results as it has devastated families. The impact of trauma is life-altering. The impact widespread in the wake of a global pandemic will be crippling. While we know trauma is a fact, so too is resilience. Despite the threat of an upcoming trauma tsunami facing our nation, there is hope. We see proof of this hope every day as parents, essential workers, and communities come together. The Campaign for Trauma-Informed Policy and Practice aspires to create a society where all children, families, and communities have the resources to thrive, even in the face of adversity. We are calling on our nation's congressional leaders and policymakers at every level to join the campaign and support trauma-informed policies and provisions. Together, we can be resilient.
So that's just one example of a video that we are using, or a tool that we have for our campaign network to use to communicate with their congresspeople. So again, like they said in the video, and then I will hand it back over to Dan, together we can be very strong. Alone, we can only get so much of this communicated to all the congresspeople that we really need buy-in from to create comprehensive trauma-informed federal legislation, which is the ultimate goal of this campaign. So one more call for everyone on this call and others in your own network to encourage them and yourselves to sign up at ctipp.org/National Trauma Campaign for our campaign. Try to sign up as a local liaison or an organization to really mobilize these calls to action to make a greater splash, because when we create this groundswell, like Marla was talking about, we'll be able to create incredible change. So I will, from there, pass it back over to Dan to discuss CTIPP CAN and other ways to be involved.
Thank you, Jesse. A couple of points just to elaborate. One of the most important people in Washington when it comes to health and social education programs is your own Senator, Senator Alexander. He's chairman of the Health, Education, Labor, Pensions Committee. Several of you have already done a great job educating him and his staff about trauma. We urge all of you, whenever you have the opportunity, to reach out to him. Secondly, Marlo was talking about the impact of trauma on education, and your neighbor down the river, Houston, after the Hurricane Harvey, the superintendent of schools, seeing the data on what happens in communities after disasters and how kids start acting out in school, required every school in the city to become trauma-informed. And that's one of our objectives, is to prepare for what's going to happen when school reopens, for all the trauma kids are going to bring to school in the fall. So this time we're prepared for what's going to happen. And Tennessee has already done extraordinary things with just the $4 million. Mary and Jen and your teams have just done incredible stuff. And our goal really is to get you additional funds so you can expand on all that work you've been doing. CTIPP is CTIPP policy and practice, and the practice is really our networking effort. And I just want to quickly report on two networking activities we have. First, we run a monthly call we call CTIPP Community Advocacy Network, a CTIPP CAN, where I'll spend a few minutes talking about what's going on in Washington on legislation involving trauma. But then the heart of the call is having reports by local trauma-informed coalitions, individuals, talking about the really creative work they're doing in their communities. We've had a counselor from a school in Fort Worth, talk about how by implementing the trauma-informed program, she was able to reduce the suspensions in the school from 890 a year to 19 while raising the academic level. We had somebody talking about a trauma-informed program for the kids of people who are asylum seekers in this country. Next, in May, we're going to have a legislator from New York State who has introduced a constitutional amendment that would require every state entity and every state subdivision to implement trauma-informed programs. So it's a chance to catch up on what is happening around the country on trauma-informed activities. Secondly, we're just launching what we're calling the statewide regional coordinators. We're going to bring together people who are leading the statewide initiatives on trauma in this state, bring them together by region to give them an opportunity to share their experiences, to network, and also an opportunity for us to give them information, the kind Marlo gave you about how to tap the funding in the CARES Act and how to partner with our volunteers so they can help us recruit volunteers, and our volunteers can help them do things like advocate with the governor or the superintendent of schools or the local education agencies to use some of the CARES Act money to promote trauma-informed programs as we come out of the quarantine. So it's another one of our networking efforts. I encourage you to join CTIPP CAN calls, and we'll be getting back to you soon when we launch our Southeast Regional statewide coordinators effort. And you don't have to have a formal statewide organization. Just we'll recruit 3 or 4 or 5 of the leaders in the state who are heading trauma-informed work. So once again, thank you for having broken the ice, paved the way, launched this country on becoming trauma-informed. And we'd like to preserve the last 22 minutes now for questions. So, Jean, do you want to take it over?
Absolutely, I would. So, yeah, thank you again so much, Dan, Jesse, Marlo, for that excellent presentation and sharing with us all about how we can get involved in this concerted, coordinated effort that you have. You all have already done such amazing work in bringing this to the forefront in front of Congress. So, I'm going to go ahead and read, for the benefit of folks that are joining us via telephone, some of the questions that have come through. The first question that we have is, will the PowerPoint slides be made available to participants?
We can do that. I will email you, Jen, the PowerPoint that you can share with all participants.
Perfect. Good deal. And this, as I shared with you all before, this webinar is being recorded. So when I send out the recording link, I'll also send out those slides. So moving on, let's see here. There was a question, and I think Elizabeth got her question answered, but it may be useful for other people on the phone. It says, how do you join the campaign? You guys shared the website, but she also asked, is there a cost? She says, I'm a professor in human ecology at Tennessee Technical University and teach trauma-informed care as a part of my students' plan of study. I implemented a trauma-informed care classroom when I taught in public schools. Yay, Elizabeth! I also taught social health in middle schools using trauma-informed approach, currently working with Senator Bailey on a bill to require social health in middle schools. Let me know the cost and how to join. It's free, right?
It is 100% free. You do not need to pay. As the fundraising chair for CTIPP, I will take a second to say, if you would like to make a generous philanthropic 100% tax-deductible donation, you can do so at ctipp.org. But your effort is far more valuable. Your experiences are far more valuable to us than your money. So it is completely free to join the campaign.
Perfect. And for those of you on the phone, if you go to www.ctipp.org, again, I'll send this out in the along with the recording. This is where you can join the national campaign, but also where you can join other efforts and learn more about CTIPP's work. The next question that we have is, let's see, this may be for Marlo. It says, is it your understanding that the additional funds that may be available in AWARE are to be earmarked specifically for trauma-informed care in schools?
So I first want to make it very clear that that potential for additional funds for AWARE is just that. It's just potential. It's something that's been put in the pipeline as a request to House leadership that it appear in future COVID legislation. But in that request for including it in the future, it says that the money would be used to address the mental health needs of students associated with trauma caused by the COVID-19 pandemic and extended school closures. So that's really all that there is right now, because there's not even legislative language yet. It's just this letter essentially putting the idea in the pipeline for consideration. So I think, in effect, the intent is to increase funding to Project Aware sites and open new Project Aware sites, recognizing their value toward being able to cause more trauma-informed approaches to occur for students across the country.
That is super helpful. Anybody that has any questions, do feel free to put them in the chat box as I continue to read what people have posted. So there's a comment from Kimberly talking about the 2020 National Drug Control Strategy, which is incorporating trauma for the first time, and she shared a link to that. So very excited about that. Also, she shares George Washington University's Pair of Aces infographic, which is something that we use pretty widely here in Tennessee, and tells local stories of resilience, and has a link to their special instructions. And Jeff Hild with GWU is involved with CTIPP and has actually presented on some of the calls in the past, if I'm not mistaken. Any other questions that we have that need to come through? Seeing any pop up?
I'll just add that Jeff Hild is specifically, you're correct that he speaks on behalf of CTIPP frequently, but he is actually one of the relatively small campaign core teams. So we are all working very closely with him, and I love the Pair of Aces infographic, and I'm so appreciative to Building Community Resilience Initiative that they made that a template. So for anybody who's not familiar with it, it's a template that directs you to sources for community level data so that you can localize it pretty easily. And so it would be a great tool to localize and then share with your congressional offices so they can see data from their district. And the other thing that the comment and sharing that resource prompts me to say is that a lot of what we're trying to do as well is communicate that there's trauma that was already occurring. We really had a trauma epidemic in our country already, and that for those people who already experienced trauma, the pandemic is only compounding that trauma. So we're being careful to help one understand that it's not that all of a sudden we have trauma just because of the pandemic. There's ongoing trauma, and so for some people, the pandemic will be their first traumatic experience, but for many, it's this trauma on top of trauma, and that's really influence from Jeff's voice and the work that he does across the country with the Building Community Resilience Initiative into our talking points and things like that we produce for the campaign.
Wonderful. Yes. Thank you so much for clarifying that. And I think we already have some partners who are using that BCR resource in their local communities. So very exciting. There are lots of people who are saying thank you, thank you, thank you. But there is another question. It says, when looking for people to partner with, it's a comment. Be sure to look into the national movement of community schools. They're advocating on the national, state, and local level, and trauma-informed practices are things that we believe in. So great comment. Thank you so much. Okay, we'll give it.
Jen,
yeah, absolutely, Dan.
I just want to add one other point in terms of joining the campaign. In addition to individuals, we encourage organizations to join the campaign. I was just thinking of Nashville has a really active trauma-informed coalition, and you have a congressman who is a major player. So we'd love to see groups like that, like the National Coalition, join the campaign, as well as individuals. Same thing for the great group in Johnson City. So join as individuals, but also join as organizations.
Wonderful. So I've got another question, and I'll take this one. It says, is it possible for a certificate of completion to be provided for this session? It was thank you. We are not doing certificates right now just because there are just some complicating factors that we're still trying to navigate as far as figuring out who's actually been engaged on the webinar versus who has not. But what I can say is that in many instances, if you send the webinar information to your accrediting body for folks that are looking for, if you're looking for CEs, they will take it. So I think that, when you got that original invitation, and then if you get the email from me afterwards with the recording links, those might provide for documentation. Okay, any other questions before we wrap up? I think we had over 160 people on this call. So Jesse, Marlo, Dan, thank you again. And if you all have any further questions for them, I'm sure they'd be happy to answer via email. I can pass that along, or I can include their emails along with the slides and the recording. All right. Well, everybody, thank you again, and stay safe and stay sane this week.
Thank you so much.
Thank you, Jen.
Thank you, Jen.
All right. Bye, everybody.
Bye-bye.
Bye.
Bye.